There are several stages of rehab treatment. The first one is detox. This is where we medically help a person to detox, to clear the drugs from their system and to have the drugs no longer impacting their body. And the next phase of treatment is residential. That is when somebody is with us for 24 hours a day receiving treatment. The focus at this time is typically on helping someone to understand their addiction and what it means for them, how it shows up for them in their life. What are their triggers? What are their cravings? Helping them to come out of the denial phase of addiction, to understand the impacts that addiction has on their family, on themselves, on their work life, and on all the different aspects for them. And to give them a little bit of time in a safe environment, free from drugs and alcohol, so that they can start to get some hope and to understand that they can move on from this. The next phase of treatment is partial hospitalization treatment, and that is typically 6 hours a day, 5-6 days a week. For us, it's 6 days a week. And this is when somebody might be still in a protective environment, or they might be living at home during this time. So this is when you get a little bit more freedom and you start to branch out a little bit and see what happens when you have less structure in your life and the things that come up for you in terms of challenges that you might face in trying to be sober with a little more freedom and a little more movement around in the world. And we're moving on then to look into the next step of things that come up for you in your recovery, and you move on to understanding more of what your needs are, what you need to put in, what sort of safeguards you need to have to help you to be able to continue your sobriety. We also want to pay close attention to any mental health disorders that are present at the time and make sure that somebody is very well stabilized in those. If those are active or they're having destabilization problems, that will make it difficult, obviously, for them to stay sober. So we pay close attention to that. And it's a time also where you're really taking a look at understanding yourself and what are the things that cause you to relapse, or what might make it more likely that you would return to use, and then finding a way to put in safeguards around that. The next level of care is intensive outpatient. And this is when the person is in treatment for approximately 3 hours a day, 3 days a week. It could be up to 5 days a week. And again, this is something that may occur with the patient living at home, or someone could live in a supportive environment. And the focus is really on all that free time. Now you're out in the world, you might be working, or you may just have a lot more time on your hands. You're volunteering, and we're trying to help the person to see what happens for them, what comes into their life, what kind of triggers, cravings, what are the things that we need to do, what happens when I go back to work, for example, and somebody invites me out to a party, and how do I handle that? Or I'm around all of my friends and everybody's going out on Saturday night. How do I make the choice to go to a meeting and spend time with sober friends instead? And also in the intensive outpatient level of care, you're prepping to go home and to be away from treatment in a large scale way. So it's making aftercare plans. What do I need to do for my sober support network? Do I need individual therapy, family therapy? Do I need to continue some sort of group therapy? Do I do 12-step meetings? What's needed for me to stay stable and sober once I'm past the treatment phase. And then the last phase of treatment can be outpatient level of care, which is generally when someone is going to see a therapist once a week or going to a treatment center for group therapy once a week, and usually involves either Smart Recovery or 12 Steps, some sort of self-help groups as well.